Good afternoon, everybody. My name is Kim Martinez, and I want to talk to you guys about something that many of us are familiar with, coronary artery disease. Now, I know this is a common diagnosis that we work with. However, statistically, we're not showing any improvement with this diagnosis. Just this year, the American Heart Association has identified coronary heart disease as the leading cause of death. Let me give you some numbers to think about. What do you think about the numbers 130 million and 1.1 trillion? Those are huge numbers, but get this. By the year 2030, the American Heart Association estimates that over 130 million adults in the United States are expected to have some sort of coronary artery disease. And the cost of treating the coronary artery disease is estimated to be $1.1 trillion. Okay, so let me give you another number, 13.5%. Any thoughts on what that's referring to? Right now, cardiac sudden death appears on 13.5% of death certificates. Okay, so let's break it down a bit. First, let's define what coronary heart disease is. Simply put, it's when the flow of blood to the heart is either reduced or blocked. So what causes it? Tobacco, obesity, poor diet, physical inactivity, hypertension, and a diagnosis that we're familiar with, but we don't always relate to heart disease, diabetes, type 2 diabetes. So how can diabetes affect and contribute to coronary artery disease? Let's think about it. Why is diabetes one of the leading contributing factors for coronary artery disease and subsequent death? Let's look at the risk factors. Obesity, inactivity, poor diet. These are all risk factors for diabetes. Also, we know that when you have diabetes, you have vessel constriction, right? Studies show that people with diabetes have higher concentrations of LDL in the plasma. With type 2 diabetes, you have insulin resistance, right? Okay, so some studies are showing that obesity is linked to fewer insulin receptors in some of the tissue, and it affects the insulin absorption. Additionally, insulin resistance has been linked to lipid accumulation. All of these contribute to coronary artery disease. Now we have it. What do? How do we treat it? The first thing we need to do is make sure our patient is not a smoker. That's one of the leading causes of coronary heart disease. Next, we have to talk to our patients about healthy activity routines and nutritional management. Carbohydrate monitoring is key for glycemic control. Incorporating the Mediterranean diet has proven to not only improve glycemic control, but lower the risks of coronary heart disease. Understanding and helping our patients to not only understand, but to incorporate it in their daily life is key. We have to give them the tools and resources to easily plan a meal, incorporate exercise into family time, finding ways to get the whole family involved. This is a family diagnosis. This is really important because this is not a disease that stops with one person in the family. Genetics can also play a role. But if you think about it, the lifestyle choices that have increased the risk of diabetes and coronary artery disease are the same lifestyle choices that are handed down to their children. By implementing these two main strategies, you will also be combating and decreasing obesity. Okay, so check this out. In some extreme cases, bariatric surgery may be an option. Studies show that metabolic and weight-related comorbidities can be improved through significant weight loss. In fact, the current term is not bariatric surgery, but metabolic surgery. Several studies have shown great improvement in glycemic control in patients with type 2 diabetes. From a heart disease perspective, there's a 63% improvement for hypertension, a 73% improvement in diabetes mellitus, and check this out, a 67% improvement for hyperlipidemia. Now, we don't have conclusive evidence that metabolic surgery will improve the vasculature, but it's looking promising. The baseline is the best treatment for coronary artery disease is prevention. And once you've been diagnosed, reversing those lifestyle choices to get you back to basic. Thank you and have a good day.